This is Nikki, and she has Netherton syndrome, also known as the Netherton syndrome. It's a rare hereditary and severe skin condition caused by a mutation in the SPINK5 gene. It comes with a weepy, red, dry and scaly skin. Within years, the skin can change from red into circular lesions on the skin, sometimes with sore scaly edges. This pattern is called ichthyosis linearis circumflexa. Most of the time, people with Netherton have an uncommon hair disorder. The hair is shaped like bamboo and it easily breaks. People with the syndrome are really sensitive to infections. Newborns with the syndrome are in serious danger, even more when they're not properly taken care of after birth. Babies may suffer from a failure to thrive. There can also be high sodium levels in the blood caused by dehydration. In the Netherlands, just 1 in a million people are born with this syndrome. Scientists believe that 1 in 200,000 people would suffer from the disease, but the diagnosis is easily missed, or newborns die just after being born because they are so vulnerable. It still happens too often that doctors are not familiar with Netherton syndrome or the way these babies look after birth, mostly red. People born with Netherton don't have the lectin protein, which is important in the regulation of shedding of the skin cells. The protein can also be involved in other processes in the body. Because the skin barrier does not function properly, the skin's natural protection is affected. Also, protection against heat and cold is affected. Warm weather, physical exercises and playing can easily lead to overheating, a serious situation. In the winter, people with Netherton often have cold hands and feet. They may even complain about the temperature on a regular summer day. There is currently no golden standard for treating Netherton. It's treated differently everywhere. Some hospitals are seeing 1 or 2 patients, and there are just a few hospitals worldwide who support several people with Netherton syndrome for a longer period of time. Most hospitals are focused on controlling and easing the flare-ups of the skin, but quality of life is much more than that. When it comes to Netherton patients, it's really important to look at the full spectrum of medical issues, like pain, itches, fatigue, growth disorder, hair disorder, allergies and asthma. But also social and mental issues can occur. These issues can vary from mild to pretty serious and are different for everyone. During life, the issues also change constantly. We have studied the current situation and found that a lot of healthcare professionals track information about their Netherton patients. For example, in a recent literature study about systemic treatment, 15 types of medication were given to 48 people with Netherton syndrome. But we were not able to compare these studies because they all described another part of the condition, different aspects of skin, hair growth, icht, quality of life. But because everyone is using a different method, it's really hard to combine the different results. And also very important, the strong needed opinions of patients are missing in a lot of the cases. The goal is to improve the care and scientific research. This is where Care4Netherton can make the difference. The goal of Care4Netherton is to improve quality of life for people with Netherton and to make it measurable. Over 70 people, patients, family and loved ones, and healthcare professionals are going to work together and create a set of outcome measures. This set will be the worldwide standard for measuring quality of life for Netherton patients. The Care4Netherton project started in 2021 in a unique collaboration of a small project group in the Netherlands and the international organization Skin. This organization is committed to help patients and professionals with rare skin disorders like Netherton syndrome within Europe. Care4Netherton is founded in the Expertise Centre in Erasmus Medical Centre in Rotterdam. The goal is to start a worldwide multidisciplinary network, provided with the best caregivers available and Netherton patients. Together, we will select the most relevant topics to work on and decide where we can improve healthcare by using the COMET protocol. These topics will be discussed during different meetings. These meetings will be held by using a pre-agreed protocol, with several discussion groups and the Delphi method. After these worldwide sessions, we can together decide which topics are crucial to provide the right care. Based on the input of the groups, experts will work on a Care4Netherton core outcome set. This set will be published and available for anyone who wants to work with it. It will be published on the website nethertonnetwork.com. The validated outcome measures can be used for babies, infants and adults with Netherton syndrome. It can be used in both healthcare and further research, and covers both patient data as clinical outcome measures. Care4Netherton ensures that we can decide about the care of one individual, but also as a group. It also helps us to communicate to other stakeholders, caregivers, and other professionals. Last but not least, it gives us a chance to learn from each other. With the outcome measures, we can finally collect and compare data worldwide. This makes us able to learn even more about Netherton syndrome and enables us to compare best practices with case studies. All of this will help us fast forward and give a boost to the care for Netherton syndrome. The more we work together, the better the care for patients with Netherton syndrome will be. Care4Netherton.